Back now on Triad today. Always glad when some of the good folks from Forsyth Plastic Surgery can drop by, especially one of their esteemed surgeons, and we have one with us right now, my good friend. Dr. Gil Kingman is here. He's a surgeon with Forsyth Plastic Surgery, been there for many, many years, and thanks for being here.
Thanks for having me.
Good to see you
Great
again.
to be here.
You know, we want to talk about some non-invasive, less invasive things, but I just want to say up front before we get to that you guys just do a tremendous job in very complex and major surgeries, breast reconstruction, because you have your own surgical suites. I mean, you do it all there, right?
Well, the breast reconstruction, for example, sometimes those are larger surgeries. We do those at the hospital.
Right.
Our suite we use mostly for the cosmetic surgery, although those can be sizable surgeries as well. And healthy patients, they get a good service.
But what I wanted to get at today, and I just wanted to preface by saying you guys do everything, but let's talk about the less invasive and non-invasive things. CoolSculpting. What is CoolSculpting?
Well, CoolSculpting we've had for many years with our partners from Allergan, and basically what it does is it allows for freezing of fat under the skin. Turns out fat is very sensitive to cold temperatures, so when you freeze it, it goes away.
Fat right under the skin.
Exactly, exactly. So there's a handpiece that goes on the area that's being treated for about 35 minutes or so, and then you move it to another area and treat that. So an abdomen might be 3 or 4 areas.
And of course it's not for everybody, because somebody like me, I'm very overweight in that area, so you can't be too overweight, because then you're sort of more of a candidate for liposuction, right?
Exactly, and so we have people come in sometimes asking if they're a candidate for CoolSculpt, and they might be better served with surgery. Now, you can have CoolSculpting and have multiple treatments, but as you get into many treatments, it can kind of resemble the price for surgery, so it's kind of a bang for your buck.
6 of one and half dozen the other. But there's no recovery time from CoolSculpting, right?
No, that's the beauty. There's no taking time off from work, there's no bruising, there's none of that, and go back to work after your treatment, basically.
Can you have any number of treatments with that, or are you restricted?
Yes, usually several treatments over a few months, and then we kind of wait and just see what kind of result that gets, but then within 2 or 3 months, you could have more treatments.
Now, I saw something on an email, I think, that you sent me, said CoolTone, and I want to understand what that is and how that's different from CoolSculpting.
Well, CoolTone is really taking contouring to the next level. So for people who are already in pretty decent shape, CoolTone is a device also with our partners from Allergan, and what that does is it provides what we call magnetic muscle stimulation. So it stimulates the muscles to contract much more than you or I could do with crunches or anything.
Right.
And so it builds and tones the muscle. So for someone who has a small amount of fat, enough so the muscle will show, they can really be sculpted.
All right, before I forget, let me go back to the CoolSculpting thing for just a second. Is any kind of anesthetic required when you're doing something like freezing, or is it uncomfortable at all while you're doing it?
Oh, good question. No, not at all. Patients will feel a little bit cold, but not uncomfortably so. They just kind of sit there and read a magazine while the treatment's going on, and no problems.
But as opposed to something like if I come in for liposuction, then there's going to be some kind of a local anesthetic or something?
Well, yeah, most liposuctions that we would want to be extensive would require general anesthesia, and that's how we do most of them. But for very small areas, those can be done in a local anesthesia. But still a little pinching and numbing.
Now, folks are always concerned, Doc, about things like cost, insurance, things like that. And so if they're listening to you right now on the radio or watching us on TV, they might be wondering, okay, this is some good information, but is there a fee for coming in and just talking to you, or do I need a referral from a physician to come in and talk with you?
We don't require physician referrals. There are fees for consultations, and those can be reduced by just signing up to get emails from us. That would be $40 if you sign up for our email.
That's a good email.
And we do charge for the consults, because people who come will find the doctors spend a lot of time with these people. It's not you're seen by staff and the doctor says, hey, okay, let's go. I mean, we sit down, full exam. Really what we want to do is diagnosis. What is your problem, and how do we fix it?
You sort of have to be a surgeon and a psychologist all in one there.
That helps.
Up on screen, ForsythPlasticSurgery.com is the website. Please check that out. Lots of good information on there, and videos and news. There's just a wealth of information. Again, for our radio listening audience, ForsythPlasticSurgery.com. Dr. Gil Kingman, thanks for coming by.